A large Latino population here in the Coachella Valley. And though we've had this big push to vaccinate farm workers, we also have many domestic workers cleaning hotels, Airbnbs, the homes of doctors and other healthcare workers. Where do domestic workers fall in the vaccination tiers? It isn't clear from CDPH's list. And what about workers who would qualify but are working without documentation? Are they disqualified?
No, we're taking care of, this is a perfect example. This site, that we're taking care of people regardless of their immigration status. I want to make that crystal clear. And by the way, I want to make something else crystal clear. Not only the safety and the efficacy of these vaccines, but there's no costs to the vaccines as well. People should just be aware of that as a level setting point. Number two, as it relates to the tiers, we do have multiple tiers in this state, 1A and 1B. 65 and over, healthcare workers in that top tier. We are now in counties large and small all across the state into the second tier, and it's based upon occupational hazard that we looked at categories like farm workers, like food service workers, like folks in childcare, and teachers as well being prioritized, as it is our priority to get our youngest cohorts back into in-person learning, particularly K through 6. It is a resolve and commitment, not just our administration, but I know of people all up and down the state of California that want to safely do that. And in order to do that, we need to prioritize for our teachers as well. As more, to your question, vaccines are made available, we expand the reach of opportunities in terms of the tiers to all of these other categories. And I can assure you, we're looking forward on the basis of supply to doing that sooner than later. But the real constraint remains manufactured supply. And so we are in those first two tiers, at least for the moment, until we get more clarity in terms of allocations later into the spring and summer months.
Thank you. Does the state have plans to vaccinate people who are currently detained in ICE detention facilities?
Well, federal detention facilities are operated uniquely and distinctively from the state. I can only talk to you about our responsibility specifically and our stewardship at CDCR and what the state of California has done. We have little over 1,000 people that have tested positive in our state system. Interestingly, none in San Quentin. I say that because, as I've noted before to many of you, every morning I wake up, one of the first things I look at on my dashboard is the number of positive patients across the spectrum, and notably in institutions like San Quentin, where we have a population that's very vulnerable. That said, we have prioritized in our state hospital system, as well as CDCR, the vaccination of key staff and people that are in the equivalent of skilled nursing facilities that are detained as priority vulnerable populations. And we have been administering the vaccine. As it relates to federal oversight, as it relates to accountability, we're in a completely different place. My gosh, as much as day is night with the Biden administration compared to where we were just 28, 29 days ago with the previous administration. That allows us more confidence that more appropriate oversight is being offered and afforded people in those federal facilities.
Thank you. This question comes from Joyce Cutler with Bloomberg Law. Would you support and sign any legislation requiring additional pandemic pay, such as cities throughout California have enacted, including Coachella?
I see the world bottom up, not top down. As a former mayor, Mr. Mayor, thank you, by the way, for the hat, which I'm taking with me. Not just this, if I may, though I may have to pay for it. As it relates to localism, I've said this often, it's determinative. As a former county supervisor, as a former mayor, I appreciate and respect the role and responsibility that cities and counties have to address local conditions and make local determinations for themselves. And so on that basis, I would subscribe to that point of view, bottom up, not top down.
Thank you. This question comes from Angela Hart with Kaiser Health News. She says, what is the rationale for selecting Blue Shield to take over California's vaccination administration without a bid, while not giving other entities a chance to compete for the project?
We want to move expeditiously. We want to move thoughtfully as well. They're doing this at no cost to the state. Blue Shield is a network of 63,000 plus physicians in their PPO, over 370 hospitals. They operate in every zip code in the state of California. They are a logistics operation. Their ability to connect this system, the scale we need in order to get where we want to go, and let me be specific where we want to go. Instead of providing upwards of 1.5 million doses of vaccine a week, which we are currently doing, we're designing a system that can provide and administer over 4 million vaccines a week, 1 to 4 million. It's incumbent that we have the clarity and the transparency of that system, the data, the analytics, the ability in a transparent and real-time way to look at provider incentives and to look at that network at scale and scope. Blue Shield was uniquely qualified to do that.
Thank you. This question comes from Jackie Botts of Cal Matters. You said in your presser yesterday that you'd be announcing the budget deal on your Golden State stimulus proposal today. Can you please help us understand how much money will be going to whom and how soon? And will there be larger payments for undocumented workers who file taxes?
So what I said yesterday, that's one component of what I said. I said we were looking forward to a joint statement, which will be forthcoming with the legislature on an agreement that included, among other things, a Golden State stimulus, that included, among other things, the $24 million that we just announced on the Housing to Harvest program, that includes, among other things, billions of dollars of small business grants targeting our most vulnerable small businesses up and down the state. Grants, not loans. Building on the successful program we launched in November, December, where we've already provided 21,000 grants, 10,000+ more this week, another 10,000 next week, and with the billions of additional dollars, we will have the capacity to provide for tens of thousands of additional small businesses, nonprofit, and cultural centers grants from $5,000 to $25,000. The details of all of those proposals and all of those agreements will be forthcoming this afternoon.
Thank you. This question comes from Taryn Luna with the LA Times. You've said repeatedly that California does not have enough vaccine to inoculate school staff before they return to the classroom. We know that roughly 200,000 school staff serve grades TK through second in California, which would return first. Yesterday, you detailed federal vaccine allocations of over 1 million doses a week to the state through the end of the month. Why are you refusing to vaccinate even 100,000 school staff per week now if it helps reopen schools for children?
No one's refusing anything, so the frame, respectfully, I reject. We are providing priority. In fact, it's been the case for many, many weeks now. Prioritization is to terms like our folks advance very, very shortly, including not just the prioritization to our teachers, which we value and we've afforded with flexibility based upon supply up and down the state for a number of weeks now, but also $6.6 billion that would address the issue of learning loss in an equitable frame and manner, and address the legitimate safety concerns not just our teachers have about returning back into in-person instruction, but also our cafeteria workers, also our janitors, also folks that are driving our kids to school and back home, our bus drivers. And so we're trying to address all of that as part of the negotiation with the legislature.
Thank you. And then this is a non-pandemic question from Janet Wilson with Desert Sun. Do you support the fracking and steaming ban bill that was introduced this morning by 2 state senators? It would also mandate a 2,500-foot setback between oil operations and homes, schools, and prisons.
God bless, forgive me. I'm really honored to be here. I was incredibly pleased to have the chance to meet with some farm workers, one who's about to get his second vaccination, another that's about to get his first vaccination, remarkable nurse that came all the way from Miami to help support those efforts. That's been my focus this morning. Humbly, I submit I have not read what was introduced apparently a few hours ago, any legislation, so I'm unable to comment on it until I have that privilege.
Thank you so much.
Appreciate it, and thank you again for the privilege of all of your time, and just again, let me just express my absolute gratitude and appreciation for these remarkable elected officials who, again, are not just dreamers, they're doers. They get it, and they're getting things done. We're really honored and proud to be here in the Valley, and thank each and every one of them for their incredible leadership. Take care, everybody. Which one?